Welcome, everyone. Thank you for joining us today. Apologies for the error on the link, but you all made it. My name is Christine Winotto, and I'm the director of the UCSF Rosenman Institute. It's my honor to have Glen Tullman at our D-Series today. But before we start, I am excited to let you know about the 2021 Rosenman Innovator program. The application is open today, so check that out. Many of our partners are providing their in-kind services range from full service integration platforms to securely exchange healthcare data, all the way to regulatory supports. And through this program, the selected company will have access to our expert advisor, investment partners, and also our Rosenman founders community. So if you're interested, or if you know other people who are interested, the deadline to apply is April 12th. And you can find all the information in the chat below. And now to the reason why you're all here today. Let me introduce you to Glen. A little bit background of Glen. Glen Tullman is the founder and former CEO of Livongo. And today, actually, we release our podcast with Glen, where Glen and I talk about his personal journey and passion. And I would encourage you to listen to it. And today, actually, Herminio is sending you the link to his podcast on the chat below. But today's talk will focus on Glen's work at Livongo. As you all know, Livongo is one of the biggest all-time success in digital health. It offers a whole person platform that empowers people with chronic condition to live better and healthier life. I like that. Glen led Levongo through the largest consumer digital health IPO in history, raised over $550 million, and the industry largest merger to date with Teladoc Health, valuing Livongo at $18.5 billion, and beginning a new era of consumer-centric virtual care. Prior to Livongo, Glen ran two other public companies, Allscripts and Enterprise System. Glen led Allscripts IPO and secondary offerings. And before Allscript, he was the CEO of Enterprise System, which he also took public and then sold to McKesson. Glen is also one of two founding partners at Seven Wire Ventures. And he's also an author of a book. His book is called On Our Terms, Empowering the New Health Consumer. He also served as a chancellor to the International Board of the Juvenile Diabetes Research Foundation and as a board member of the American Diabetes Association. Glen is dedicated to finding a cure for diabetes and other chronic conditions and keeping people healthy until these cures are found. He also has three amazing children that inspire him every day, and one of them inspired him to start Livongo. And so I think you might heard me earlier today in the talk is that you will all have the opportunity to ask Glen your question. Please enter your question on the Q&A section on the Zoom, and we will have the Q&A sessions toward the end after my question. So welcome, Glen.
Thank you. It's great to be with you again today.
Great. It's such an honor to have you here today. And first, again, congratulations on your success of Livongo. It must be exciting to see your product that you built have helped so many people.
Well, I think what was most exciting, a lot of people, when we announced the merger, talked about the price of the merger, $18.5 billion, but most of our people, most of our employees were excited that we had just crossed 1 million people using Livongo products. And that means we had diabetes or hypertension or weight management issues or mental health issues, and they were healthier because they were using our products. So I think there was a lot of pride in that, and continues to be a source of pride as Teladoc continues in the focus on virtual primary care, which I think is going to be a big part of our future.
Yeah. So like I said, we're going to talk a little bit more about the Livongo stories. And maybe, as I said earlier, that your youngest son, Sam, was diagnosed with type 1 diabetes when he was 8, and which exposed you to the importance of healthcare and how hard it is for people to manage chronic condition and that's what Livongo came about. But can you bring us back to your process, how the idea of Livongo got started, and how did the idea change as you progress after you first raised the first 3 million? And has that changed once you got to the 20, the 40, 50, and then 105? How did that progress?
Sure. Sure. Well, I think that, there's really two different starts to Livongo. One had to do with my son, Sam, as you mentioned. And when he was diagnosed with type 1 diabetes, it was shocking to me how hard we made it for people with a chronic condition like diabetes to stay healthy. You would think that we'd be doing everything we could to make it easier to keep someone out of the hospital and keep them healthy. But instead, we kept running into hurdles along the way. For example, if you have diabetes, you take a little lancet and you prick your finger and you put it on a little test strip and you check to see what your blood sugar is because your body doesn't automatically regulate it. And so occasionally, Sam would run out of strips or he'd start to run short of strips, and we'd call our insurance company and they'd say, "Oh, we can't give you strips for 2 weeks, but we can send you needles now." And I really wanted to strangle someone at that point. And they'd say, "Or if it's an emergency, you can go to the hospital." So I would think to myself, so they want me to go to the hospital to get a $5 vial of strips, which, by the way, they're overcharging us and they're charging us $30 or $40 for. And the whole process didn't make sense. The second thing was that if you needed to talk to somebody because you had a question and it was after the hours of 8 to 5, you couldn't get to anybody. And once again, well, you could go to the ER, but you didn't want to go to the ER. You just had a simple question. And our healthcare system hasn't really been developed for the people who need to use it. Mm-hmm. So it's been developed for almost everybody else. So that was the idea. Livongo was really about making it easier for people to stay healthy. And we had this idea, and it was kind of considered a crazy idea, that if you made it easier for people to stay healthy, they would not only be healthier, but they would cost less because they didn't end up in the ER. Mm-hmm. And then we also took on some of these myths about, strip costs because, there are people, and still today, insurance companies and others charging people $30 and $40 and $50 for a vial of strips that only cost $5 to produce. Mm-hmm. And the idea that they're doing that, and we've all heard about the inflation, insulin has gone up 500% over the last 5 years, and that's just criminal. And yet the people who we thought were supposed to be helping us, in fact, were actually skimming dollars out of the process. And that's, insurance companies, and that's PBMs and others who haven't been helpful in keeping us healthier. So I think there's this push to say we can do better. And that's what Livongo is about. But I think you're going to see more and more innovation coming where people are basically saying it didn't work, it's not working, and we have to figure out new ways to do it. That's what's going to drive a lot of innovation. And I think that's why you're going to see new entrants, whether it's Amazon, whether it's Walmart, or whether it's other large entities who are very consumer focused and very focused on how do we really drive the price down of healthcare and improve the quality at the same time. So that was one piece of it. The other piece was looking at the market. And these markets in healthcare are the largest and fastest growing markets in the world. So, it's interesting from a business perspective. Healthcare is kind of fascinating because you can't solve the problem. And what I mean by that is the longer we keep people alive, the more they're going to have different issues. So before, you didn't need new hips at the age of 70 because most people didn't live to 70. Now we not only live to 70, but we expect to be playing tennis and running and doing other things, which is wonderful. But that means that our healthcare costs will increase. We just have to make sure we're paying for the right thing and we're getting real value out of the healthcare system. And I think there's a lot of room for innovation. And I think we're going to see it in the next few years. Interestingly, the coronavirus, while we clearly mourn the loss of life and the economic hardship and the mental health issues that will come from it, I think one of the few positives may be that this has advanced our move toward digital in healthcare dramatically. And it's
Right.
also shown people in many industries that with the right leadership, we can make enormous progress. I think we've also seen it even in things like the development of a vaccine in a year. When we focus on healthcare issues, we can make real progress, but we have to have the right leadership to do it. And we've not
Right.
had that.
Yeah. So going back to, like, when you started Livongo, when from the beginning, you have that vision and you have that roadmap. And how often do you change that roadmap to get to your final destination where it is today?
Well, it's a great question because in many businesses, you have to be prepared to pivot, and you're pivoting based on your feedback from your customer, the consumer, the member, as we call them at Livongo. Interestingly, at Livongo, and the name comes from when we surveyed people who had diabetes, they didn't say, I want better diabetes supplies or anything. They simply said, I want to live my life. And I just want to live my life. And second, I'm on the go. So don't give me a solution that requires me to be at work or at a clinic or anything else. I'm on the go. So living their life on the go, Levongo, living on the go. So that's where that name came from. And I think we probably pivoted less at Levongo than at almost any other business because we had such a great understanding of the user experience. And why? Because more than a third of the people, and it was probably half of the people when we started the business, either had diabetes, had a family member who did, or had a very close friend or relative who did. And so there was an enormous commitment and passion about diabetes and understanding of it. And so, our president, who was, when she first came on board, our chief medical officer, Dr. Jennifer Schneider, she had lived with diabetes. She knew exactly what it was like. She knew exactly what the frustrations were. And about half of our senior leadership team had very direct experience. And so consequently, we didn't have to hire somebody to tell us. We had lived this. And that made the path very clear, which was, how do we actually empower people? Not how do we tell them what to do? They've been told what to do way too much. And in fact, if you think about our healthcare experience today, healthcare happens to us, and instead we want to put people back in charge. And, you mentioned my book, On Our Terms. We want it on our terms. Today, it's if you have something wrong, think about that experience. Hopefully you can get in to see a doctor, but not necessarily right now. You might have to wait a week for a specialist, could be 3 weeks. This is serious stuff, and you have to wait weeks. And then second, you have to go when it's convenient for them. Then let's say you get a lab test, and you might wait 3 or 4 days. I've heard people who are waiting to find out whether they have cancer. You're waiting 3 or 4 days. Sometimes it's because the doctor's not available to read it.
Right.
It's outrageous. And we wouldn't put up with that in any other area. And somehow we've been conditioned to think that we should do that. And that's changing. So, again, telehealth, what that says is anytime I want,
Right.
I can literally press a button and be talking to a person or be chatting with a person on my terms when I want. It can be the middle of the night. It can be Friday night. It can be in the morning. And that might be a simple question. And I've got a responsive person who's there who will assist me. And that's magical. Like if you think about it, Google, you can use it anytime, anywhere in the world, 24 hours a day, and it's free. Amazon, you can use it anytime. You get great information. You can have things delivered right to your home, 24 hours a day. And then we get to healthcare, and it's like, well, if you're lucky, maybe next week between 8 and 5.
Right.
And guess what? Most people work between 8 and 5. So if you're a shift worker, you can't go and get healthcare. And it's very costly. And so we wanted to change that. telehealth has made that available to everyone.
Yeah.
Again, it's taken away a lot of the stigma. So certain things that, you would have to go in for, go to an office and see a therapist. Well, again, lots of companies, whether it be, Teladoc and whether it be at Livongo, we had My Strength, Teladoc BetterHelp, there's Talkspace, there's a whole number of choices now that you can have to stay mentally healthy. Really, really important. And that's also important to being physically healthy. So it's available anywhere. You don't need transportation. So I think we're seeing this whole new form of virtual care that puts people back in charge of their care. And now we're going to see, I think, in the lab space, instead of waiting for days, you're going to be able to do lab testing at home. You're going to be able to do it at your local Walgreens or CVS. And so all this is going to move away from that one centralized location. And that's really the prospect. One of, I think, probably the hottest, most successful entrepreneur in Silicon Valley, Hemant Taneja from General Catalyst. He wrote a book, which is right there, that yellow book.
Oh, what is that?
And the book is called Unscaled. And what it talks about is the fact that we had centralized, things normally get centralized. You have a mainframe computer, it's really big. Then it goes to a mini, and then it goes to a personal computer, then it goes to a phone. So you have all the knowledge is in the church. And then we developed technology called a printing press, and now it's more available, but it's still expensive, and maybe it's in a library. But then Google comes along and it democratizes it, and it's everywhere. And so what happens is you see centralization, and then technology allows us to decentralize, democratize, make it available to more people. So that's what we're going to see in healthcare. And that's what's so exciting about what's coming. And believe it or not, the coronavirus will have accelerated that. It's maybe one of the few good things that has come from the coronavirus.
Right. And I think, with your Levongo story, I think in the beginning of the year, Express Script announced the Levongo is part of their digital formulary. And then pandemic happened and your membership also went up. A lot more people become more comfortable with the virtual care as well. And they
interestingly, Livongo, the growth rate before and after the pandemic didn't change a whole lot. So we were growing very rapidly like this, even before. And Express Scripts has been great in terms of promoting what we do, and they've been a real innovator. So I give them a lot of credit. So we were growing. Where you saw the real acceleration was telehealth. The normal rates of telehealth were between 3 and 8% pre-pandemic.
Right.
Then the pandemic hit, and literally it went all the way up to some cases 100%, then at 80%. Now it's settled in at about 40-ish percent, 30 to 40%, which is 10 times what it was a year ago. So think about taking the country and taking this service and in 1 year growing 10 times the amount. And that's what happened. So Livongo fortunately was growing very rapidly before and kept growing, but telehealth and other services, virtual physical therapy, that was through our venture fund. We have an investment in a company called Resource One. And, that again is a perfect example of people, were using it, but at a slow rate. Then the pandemic came and no one wanted to go in a big room with a bunch of other people laying on the same tables. So all of a sudden, that business took off, and we've seen a lot of that acceleration. So, while that wasn't directly a part of the Livongo experience, it was surely a part of digital health. Right. And that, I think there were two big boosts. One was coronavirus, which forced people to use digital. And second, the Livongo IPO, and then, less than a year later, the actual merger of the business made a lot of people say, hey, I want to invest in this area. So lots of our competitors called and other people and said, thank you, Livongo, you've just doubled our valuation. And, so we were happy to be helpful in that way as well. Because I think it's a good thing. I think we want a very healthy digital industry.
Right.
And if you see how, Teladoc has done extremely well post-merger, because again, it's becoming the standard of what should happen.
Yeah. And I think you were saying a lot earlier about scaling up, how important it is to scale. And Livongo did that, leading up to the IPO and now even more. And give us some sense, like how do you, start from, small and then scale up to where it is? Like what are the things that many of the entrepreneurs are starting a company with the idea that they want to build the company and scale up? Like what are things to look for? And
well, first of all, a lot of people say Livongo was an overnight success. And I would remind people that one, it took 6 years. Two, there were a lot of all-nighters. And it wasn't always, it wasn't always destined to be that way. Mm-hmm. So you had to work and you had to keep working at it. And we had a lot of resistance from the industry, people who wanted to price the old way. So at Livongo, one of our innovations was we only charged if you use the service. Mm-hmm. And we only charged if you kept using the service. And yet there were people in the industry who wanted to go back to the old way of saying, no, let's just charge everybody, whether you use it or not. And it seems lower. But that's a trick because basically they're charging you, then they don't care whether you use it or not. They don't care whether it works. They're saying, yeah, but it costs less, but you don't have the metrics. So, from that standpoint, what I would say is that when you're starting any business, they're all small. And, our first funding round, I think valued the company at $10 million. So that's a long way from 18.5 billion. Mm-hmm. In each round, and we did a Series A, Series B, a Series C, a Series D, and a Series E before our IPO. So, and we did one almost, if you do the math, almost one per year. And then in the year of our IPO, we did the IPO. A few months later, we did a secondary offering. Then we did a convertible for about $550 million. And then we did the merger all within 12 months. So I'm not sure anybody has done that many transactions in 12 months, but along the way, it's about every day going in there and really being focused on, what is your vision? What is your mission? We never built the company to sell it. We built the company to serve our members. It was really important to us. And it's funny because we also, as you mentioned, Lee Shapiro, who's been my longtime business partner for more than 25 years, I think. And, we've been doing businesses together and he's, started SevenWire with me. But one of the questions we ask sometimes when we're deciding to make an investment, I'll say, what's your exit strategy? And if someone has a really good exit strategy, we almost never invest because we want people who say, I love this. I'm not doing it to make money. I'm not doing it to exit. I'm doing it because it's an important, good business to build. And if I end up doing this for the rest of my life, so be it. I'm getting paid and I love what I'm doing. Yeah. And if it comes along, like it makes sense. And, a lot of people say, well, Livongo, I'm surprised you sold it. Well, what's the reason we did that? So we had a few objectives. One, we wanted to be international. Two, we wanted to get the solution to as many people as possible. And three, we had people who would call us in the middle of the night and they would say, I have a sinus infection. And we'd say, well, why are you calling us? And they'd say, because you're the only ones who pick up the phone. You're the only ones who really want to help me. You're the only ones I trust. So we said, well, we have to expand. If we're going to take care of the whole person, we have to expand what we're doing. Mm-hmm. And so we were looking to make acquisitions, and along comes Teladoc. They're already in more than 50 countries. So that was our international expansion. They didn't have any clinical products that overlap with us. We didn't have telehealth and that overlapped with them. And on behavioral health, they had a great service that was live people, and we had the front end digital. So that fit together. And then we looked at our customers, and there was only 25% overlap. And, basically we looked at each other and we said, this is as perfect a fit you're going to get. And I thought to myself, if we really want this solution to go global, this is the fastest, best way to do it. And so that's why that mattered. But along the way, we celebrated when we had 1,000 people using it, we celebrated. When we had 5,000 people, we celebrated. When we had 10,000. And that's how, how we built it, which was, it's kind of like we like to say, how do you eat an elephant? And it's bite by bite. And how do you build a business? You don't just overnight say we're $1 billion business. You have to take the steps and focus not on how much you're worth. Focus on the value you're adding. Become indispensable for people. And, again, we had 3 metrics and we stuck with them the entire business. 1, do people love us? Not just like us. Do they love us? Because if they like you, you're just waiting to be replaced. But if they love you, they aren't leaving. And second, do we actually deliver measurable clinical value? And that was really important because we wanted to. My own son was using this. And if he didn't like it, and if it didn't make him, help him, power him to make his life easier and better, then why were we doing this? Last but not least, were we able to deliver actual savings because we kept people healthy? Those were always our metrics. But, you have to put things in the right order. Again, as we looked at our values, first was member. Member always came first. Next after member was our client. Those are the people who paid us. Next were our employees. Next was the communities that we operated in. And in every community where we had people, aggregations of people or offices, we would fund a homeless shelter, a battered women's clinic, a food depository, and then more recently, efforts to promote racial justice. And we did that. Why? Because we know that part of what good companies do is support the communities they operate in. And then last but not least, taking care of our investors. And sometimes when I would say that, our investors would bristle a little bit and say, why are we last on that? And I would say, because if we do the other things right, you will be the happiest people in the world. Right. But if we start making decisions that are investor focused first, we'll lose our way. And sadly today, so many of our companies that call themselves healthcare companies and are making record profits, they aren't delivering great care for the people they serve. And they have to step up, and we have to change that and get back to, and I'd be fine if they called themselves financial companies because that's what they are, but they aren't healthcare companies, because then they truly put their members first. Their CEOs would know, like I knew, if somebody had a problem, it went all the way up to me. I mean, we were so focused. If somebody said, oh, my unit broke, we wouldn't argue with them. We'd say, well, FedEx you one tomorrow, you'll have it tomorrow morning. So sorry. We didn't say, why did it break? We didn't say anything like that. We were focused on their care, and they understood that. And that was, I think, the difference.
Yeah, no, I love that. The customer oriented is almost like we see that a lot in the retail, like in Zappos and Amazon. And I think that, like you're saying, in healthcare, somehow we seems to be okay to have second or third rate customer service. And I think Livongo changed that.
That's the standard. I mean, it's funny because recently I was at the Gap, I think, or Banana Republic, and I was getting some jeans. And I thought to myself, here was this wonderful salesperson, and they spent about 15 minutes with me. They explained there's 5 different kinds of jeans available, but I could only get 3 because 2 of them wouldn't look good on me. Skinny jeans, not for you. And so I really appreciated this curated choice. And I realized this person spent more time with me to buy a pair of jeans then when I had to have an MRI a year before and I was asking questions, they couldn't wait to get me off the phone. And I was like, I'm just trying to ask some questions. And they're like, well, it'd be better. You can go out, you can look at this, you can do this. And they had no interest. And I was thinking to myself, something's wrong when people will take better care of you buying jeans than they will in our healthcare system. And so again, that's what we have to flip. And you're going to see it. And it's going to be, people will start to say, I'm going to go where I can trust people, where I can get high quality care. And increasingly, since people are paying more and more of the cost anyway, they're going to make choices that are the best economic choices. Today, if you need surgery, you can go to a hospital recommended by your health plan that costs twice as much as a surgery center right next door. And that surgery center may have half the infection rate and use the exact same doctors. But your health plan won't necessarily tell you about it because they're not on their network. Doesn't make any sense at all. They should have to tell you the highest quality places, and they should tell businesses where are the lowest overall cost. And again, that's what we have to change in the system.
Yeah, I was talking to Cezanne, a company down in the peninsula, company called Health at Scale. And that's what they're trying to do, to match members with the right providers, not just based on who is in their network. So that's interesting concept.
Yeah, so much opportunity. So everybody who's listening, I mean, this is not only so important to do, to know that at the end of the day, when you're tired, you were working for something so important, but the opportunity, the business opportunity is immense. It's enormous. And it's all there. So now we just have to do it. Yeah.
I want to ask you one last question before we go to the audience. You're saying Levongo is not an overnight success. Oftentimes the hardship is not out in public. Can you share with us, many of the company, who become successful, they have many near-death experience. And give us 2 examples of your Livongo time that you had the near-death experience, not you personally, but the Livongo company.
Well, early on in the company, some of the large payers were not happy because we were carving out parts of their business. We were saying, hey, like large self-insured employers would say, I'm going to use Livongo. And literally, some of the plans would say, if you use Livongo, we will charge you more on the things you're not using. And which was kind of crazy and illegal to do, but they were doing it anyway. And, we didn't know. And luckily, there were a few large self-insured employers who basically said, look, we're not, we've given you chance after chance to fix this problem. You haven't. We're going to give this young entrepreneurial company a chance. But had they not done that, the anti-competitive behavior from not all, but many of the large payers, they could have driven us out of business. And we have documentation from large payers that said this to customers. And you can imagine going in as a small customer or as a small company, and this large company says, well, if you use that small company, we'll raise your other rates. And you're kind of like, well, you better not use them then. And so people say, well, that's illegal. You could sue them. Well, are you going to sue the largest insurance companies? And then I think more recently, we've seen similar kinds of behaviors from some organizations who have said, wow, Levongo, you're getting pretty successful. We're going to surcharge you, or we're going to charge you to use our network or to distribute your product. So let's say Levongo costs $70 a month. Well, some of the folks we're dealing with say, well, you have to give us $10 of that $70 a month, even though we're not adding value. And otherwise, we're going to cut you out of the network. And so, again, we've seen that behavior. And
how did you guys overcome that particular challenge?
Well, I think initially, we paid some of that, and then at a certain point, it's like a loan shark. They just keep raising the fee. And at a certain point, you have to say no. And they say, well, then you're going to lose our business. We'll replace you. We'll imitate you. And that's where the fight is. Luckily, because we had such a strong following from companies and from customers who loved us, even though they tried to get us out, they weren't able to. So, but those were both very much near-death experiences because it could have gone either way. And, we were fortunate we had gained enough momentum at the time. Had it been a year earlier, it could have been, devastating. So, from that standpoint, I think we were very fortunate.
Yeah. So let's start with the Q&A.
Great.
Session. Let's see. Let me go. One of the questions that I often hear from investor actually, when they say, well, that company, if you focus on one particular area, say diabetic foot ulcer, Livongo can just do something like that. And then what's the value of your company? How do you, what advice do you have for a company who have one, focus scope area for one particular area? And so it's not like having a platform, I guess.
Well, I think that
somebody else can, just copy your idea and then run with it.
Yeah. Well, I think, first of all, in many businesses today, you have friends and enemies and frenemies. So at any time, Amazon, for example, was a big customer of Levongo, a great customer of Levongo. And yet, did I believe that Amazon is also trying to develop similar services as Levongo? Yes. And if they develop something better, we're in trouble. So we have to never take our clients for granted. We have to never take the member experience for granted. You have to do an extraordinary job, and that's just part of what it is. I think we are moving to more platforms, and the reason is that if you have multiple chronic conditions, you don't want 4 different apps and 5 different coaches, and
right.
You want an integrated experience. We want to treat the whole person. So from that perspective, I do think that we're going to see movements to more platforms. On the other hand, if you're really good at what you do, you're going to be incorporated into platforms and you're going to figure that out. If you're average, then it's going to be tough. It's going to be harder. So I think that's what, what I would say there.
Okay, next question from Anya. How should digital health companies choose their business model? And what was your journey towards making that decision? Direct to customer versus pharma versus insurance versus corporate employee benefits?
Well, our model was B2B2C. So rather than going direct to the consumer, we took the approach that it was easier to find partners to help us distribute. Now, we had multiple models. So initially, we went to some large companies. And if the companies are big enough, they can help you get started. Then, as we were successful with some of those companies, people like Target or Boeing or real innovators, and we went to them and they helped us. And then when we got noticed, then some of the PBMs and payers started to say, hey, this really works. We'll help you distribute. Sometimes they charge you a lot to help you distribute. And so that was kind of the model, which was that we used, first starting with large self-insured employers, then based on the success, working with PBMs and some of the more innovative payers, and ultimately, having models for all of the above, which is direct, and then working with self-insured employers, then working with PBMs and payers. So I think you have to figure it out. Going direct to consumer tends to be expensive and harder to do initially, but some companies have been very successful. Noom, as an example, has, done a huge business going direct to consumer. I mentioned earlier that, Teladoc, their behavioral health business, BetterHelp, they've done a ton of advertising on podcasts, and that's how they built a lot of that business. So, you just have to figure out what model works best for you, and then, go for it. But you got to give that a lot of thought, because if you don't pick the right distribution model, it's harder to do.
Okay. Next question. This is from somebody who is in business school from MIT. Gimme, how did you go about raising your first round of funding, and who set the valuation?
Yeah, in most businesses that I've found, and in many businesses that we invest in, the first round of funding is really friends and family. It's personal. It's wherever you can get it. So in many startups, that's what it is, and that was no different for Levongo. Before, that's what's called a seed round in many cases, and you get it from whoever you can get it from. So you might know someone. We have a company in the portfolio called NoCD, and that's it's a company focused on OCD, obsessive compulsive disorder, but it's called NoCD. And the entrepreneur there, came and I met with him. I was an early funder, and he said, can I get $25,000? And I said, well, you go out and raise 25 and I'll give you 25. And this wasn't our fund, this was me personally. So he came back and he said, I've raised 20. And I said, you got to raise 25. And I wanted to see how committed was he. And he came back and he raised 25. I gave him 25. And then came back later and he said, I need 50 now. And I said, well, go out and raise 50. But by then we could see it was going to be a real business. And today that business is worth 25 or $30 million. So, but usually it starts with a seed round. And the idea is if you can't convince your friends and family to invest, then, how are you going to convince other people? And, we want people who are that committed. So that's how it usually starts. And then we put up personal money. And only then did we go outside and bring in some of our great partners like General Catalyst and other firms.
I think earlier you mentioned a lot about the corporate self-funded company. You see many of your first customers were employers. And how do you see the trend in terms of like their role in the healthcare and paying for healthcare?
Well, I think that, if you look at large self-insured employers, they're paying for just under half of the insurance in the country, in the US today. So they have a vested interest. And if you think of organizations that are out there, there's a lot of self-insured employer organizations working very hard to try to find solutions to reduce the overall cost of healthcare and also to improve the quality of healthcare. So I think large self-insured employers are going to drive all of the innovation and the change in healthcare. And then I think the government's going to follow along. I don't think it's going to be driven from the government, even though I'm so pleased that we have an administration now running the country that believes in science and that is, rational about our healthcare. I think if we've learned anything from the coronavirus, we learned that when it comes to healthcare, we're all one. We're all one country. We're all one community. And if you don't take care of certain people in the community, then guess what? They're going to spread the virus because those are essential workers and those are other folks. And so when it comes to healthcare, we're one big family, and we really are. And frankly, you can make that same argument across the world. So it's not about blaming some other country for starting this, because who knows where the next one's going to start. Right. But it's about how do we say there's certain things that we rise above our nationalist tendencies. We can argue about lots of things in the Congress or this or that, but on our healthcare, basic healthcare, we need to take care of people. And so from that perspective, I think that, we've learned that, but I think that innovation is going to come from the private sector, and it's going to be driven by large self-insured employers who really lead in that area.
Well, you saw the announcement earlier at the end of last year, I think, where JP Morgan, Amazon, and Berkshire Hathaway dissolved their healthcare company. So is the idea more maybe we should let startup do the innovation more than the large company?
Well, I think first of all, I think that effort was born out of the fact that those three unbelievably amazing, well-respected companies concluded that they needed to start their own company because the existing healthcare providers weren't getting the job done. So that's the first message, which if you're an existing healthcare provider and your biggest customers say, we have to start our own company, something's not working. And the second thing is, I think, a lot of people look at that and say, wow, that didn't work. I think it worked. And I think what you're going to see is out of that is going to spring enormous amounts of innovation that come out of that. So some people are saying, well, see, they weren't able to do it. That's not the right way to look at it. Anybody who thinks those companies have given up doesn't know those companies. Those are great companies, and they're going to be active in solving the healthcare problem.
So they're cooking something behind that is just, we don't know.
All I can tell you is companies that are that good, those are three of the best companies in the world. And, they did it for a reason. They undid it for a reason. And we'll all see that over a period of time. I wouldn't hazard to guess what that'll look like, but, these are great companies.
Yeah. Okay. Next question. How do you see the field of telehealth evolve in the next 5 years and post-pandemics?
Yeah, I think that telehealth is ultimately, it's about virtual care. And I think in 5 years, we won't talk about telehealth. We'll talk about health. Just like today, if you talk about retail, you don't ask a company, do you have a website? Like they would look at you like, what? Of course we have a website. Do you use that thing called the internet? No, you don't say that. In healthcare, what we're evolving to is something that says we will meet people where they are. We'll let those people make the judgment. And so we're going to have things like at-home lab testing. We're going to have people who can access care 24 hours a day, anywhere in the world, to talk to physicians and specialists. And those specialists and physicians are going to know who they are, know all their information. So it's all going to come together. Again, there's a wonderful saying that we always overestimate the impact of technology in the beginning and underestimate it in the long term. So we said computers are going to change the world when they first came out, and there was a big disappointment. It didn't really change much at all. And then, now look at our world.
Right.
But look at healthcare. Electronic health records are going to change the world. And everybody was disappointed. But in fact, that was a necessary step to digitize the information, to get it ready for what came next.
Right.
What comes next is not going to come from the traditional companies. In fact, now you could argue that those companies are actually slowing innovation. Epic isn't leading innovation, they're slowing innovation. But having that information digitized, you're going to have new startups. Cumura is one that's out there, and it sits on top of Epic, and it allows innovation to happen. And it's turned Epic and other electronic health records into a data repository. But it's saying if you want to innovate, overlay Cumura on top of it, and wow, now you can do amazing things with that. So we just, in the short term, we overestimated. In the long term, we're going to have what we all dream about. And now that's all getting accelerated because we found out, oh my gosh, this health thing is not just important for each of us. You can't run the economy without having health.
Right.
And now all of a sudden, health becomes a national priority, as it should have been. And so again, that's the lesson. I hope we learn it, and I think we will. And I know it's driving innovation.
Yeah. Okay. Last question. I think we only have one more dream for one last question. What might be the major differentiators for Livongo as compared to their competitors with similar solution like Omada Health Vida Health that contributed to the much more successful growth that has led to IPO?
Yeah, well, look, the reality, and I'm not running it anymore, so I can be objective. Levongo didn't have any competitors. Omada was essentially a diabetes prevention company, which was diabetes prevention is essentially weight loss. That's what it was. So they never meaningfully were a competitor for Livongo. And Virta, I think you said Virta, is that right?
Vida Health.
Oh, Vida. Yeah. So again, I don't. Virta, Vida, both of them they're kind of imitators, and it's kind of like whenever somebody says their strategy is, I want to be like another company. Like when you hear somebody said, we're just like an iPhone, that means they aren't just like an iPhone. That means they're nothing like an iPhone. So those companies were just not at scale. They were interesting, but not at scale. I wish them well. I wish anybody well. I think competition is good. But for Livongo, there wasn't really competition in terms of an integrated experience for people with chronic conditions. And that just didn't exist. And, again, part of why Teladoc paid what it paid for Livongo, which was the second highest multiple ever paid after WhatsApp, was because they understood that. They understood that it wasn't, you couldn't recreate it. And what was built there was very, very unique. And so, that said, and look, Omada is a good company. All the ones you mentioned, they're fine, but they weren't real competition for Livongo. They were just, they had, again, one sliver of what Livongo had, and they weren't at scale the way Livongo was. So again, I don't mean to say anything bad about Omada. It's a good company. Frankly, early on when we started Livongo, I took a lot of inspiration from Omada and what they were doing. And they did some very good things in their space. We were just much broader than they were. And we had much more of a focus on people with diabetes, not prevention, which was one of the products that we sold.
Okay. Well, great. Well, with that, thank you so much for your time and sharing with us your insight.
Well, thank you. It's always great to talk. I'm a little passionate about this stuff, but I would just encourage whoever is listening, one, there is nothing more important for our country, for the world, than solving these healthcare problems, keeping people healthy, and first and foremost, putting that, front and center. And if you do that, the rest will take care of itself. And I'd encourage you to put all your efforts into something you believe in, because we have great opportunities here, and it's important, meaningful work to do. And that's what we all should strive for. So thank you for the opportunity, and we'll look forward to our next conversation.
Sounds good. Thanks so much. Have a good afternoon.
Thanks. Thanks, everybody.
Thanks, everybody. Bye.